Health and Human Services Secretary Robert F. Kennedy Jr. naming 8 new members to a key government panel of vaccine advisors after firing the previous panel of 17 members a few days ago. The group reviews vaccine data and makes recommendations that determine who is eligible for shots and whether insurers should actually cover those shots. On X, Kennedy said that the 8 new advisors will attend a meeting of the panel later this month. Among the new picks are some well-known vaccine critics, including one doctor who suggested earlier this year, without evidence, that recent measles deaths among children were because of medical errors rather than the virus itself. There is at least one member who identifies as an anti-vaxxer, and this is not exactly what people had been hoping to see. If you talk to some of the senators who had signed off on this, I think we talked about the Louisiana senator earlier this week who had some concerns as a medical doctor. He approved RFK Jr.'s nomination, but he has said that he's spoken with him about this and it will continue to monitor the situation.
If you had 7 that were, not anti-vaxxers and one who's an actual accredited, well-known, published scientist that has concerns with it, I could see that. But I don't know.
Having concerns with vaccines, I think, is a little different
than being an anti-vaxxer.
Than calling yourself an anti-vaxxer.
It's kind of scary.
And raising questions about whether the measles deaths were actually called by measles.
I have no idea what the guy actually said or about that individual case with me. But we're at a point in time where we certainly do give out a lot of vaccines, and there's still scientifically, you'd like to at least know more about the long-term effects on the immune system of bombarding someone with vaccines early on.
Sure, but I do think that the people who were concerned about what RFK Jr. would do in this role are seeing it play out the way they had feared it might, just in terms of
I don't know if the jury's totally in on that it's just going to be rabid anti-science conspiracy.
No, but we used to talk to Scott Gottlieb, who was the head of the FDA during the first Trump administration, about his concerns with the vaccine requirements during COVID because he worried that it would lead to vaccine backlash. And we have seen the number of people who are willing to take vaccines drop. We worry that you get to the point where you no longer have herd immunity on some of these because you raise so many questions about the vaccines.
Definitely the way that it was handled by Fauci and others, some of that backlash
and that's what Gottlieb used to talk about.
Because it didn't prevent infection, number one. And a lot of the stuff that they told us about lockdowns, about masks, about none of it was based on science.
The vaccines did not prevent infection,
but you
think that it probably prevented the worst case scenarios of some of these things happening.
I would agree with that, but whether young, healthy people, I mean, I look at Djokovic now and I think, wow.
Yeah, there are questions about whether young boys in particular should take it because of the risk of myocarditis. And by the way, I've spoken with my doctors who are generally in favor of vaccines who raise some of the same questions about for young men in particular because of...
Or healthy people. I mean, if you're not 80, you probably weren't going to die.
Again, it depends on the variant that came through. Some of the variants were much worse than others.
None of the variants was the mortality rate for a 40-year-old healthy person worth, perhaps, if there were, at that point. I don't know. The Army shouldn't have been going door to door to give people vaccines.